The coronavirus outbreak continues to grip the tri-state area with a spike in cases this morning. I'm Chris Raggi.
And I'm Mary Calvi. Thanks for starting your day with us. The outbreak now impacting Bergen County in New Jersey, along with New York City, Westchester County, and Nassau County. Right now, there are 22 cases across New York and 2 cases in New Jersey.
We are live with team coverage this morning, beginning with Jenna DeAngelis live outside NYU Winthrop Hospital in Mineola. Jenna?
Chris and Mary, this is where a 42-year-old man is hospitalized, the first confirmed case here on Long Island, and we're told his condition is improving. Health officials are now working to figure out how he got the coronavirus, saying he did not travel or have contact with anyone else who tested positive. It's a race against the clock for officials trying to trace the path of the coronavirus in our area as the number of confirmed cases in New York doubled Thursday, with at least 22 people infected and more expected.
The more people you test, the more positives you are going to find.
The biggest spike in Westchester County. The first confirmed case there, a New Rochelle attorney who remains hospitalized. 17 people linked to him have also tested positive and are isolated in their homes. That includes Rabbi Reuben Fink, confirmed overnight in this tweet from Yeshiva University. In New York City, there are 2 new cases, a man in his 40s and a woman in her 80s. Long Island now has its first positive case, a 42-year-old Nassau County man.
The goal now is to avoid community spread.
Those in close contact with the patient have been advised to isolate themselves. The same rule applies in New Jersey, where officials are investigating the first 2 positive cases in the state, including a New York healthcare worker in his 30s who lives in Fort Lee.
We do have Bergen County residents that were identified to have had contact with those from the New Rochelle incident, and those people are self-quarantined.
Officials say testing those quarantined is key, but there are only 1,000 test kits available in New York City.
We need the CDC to send more test kits because we anticipate that we're gonna burn through these.
We need to get to the point where we can do hundreds a day, every day, maybe even more at some point, and we're not there yet.
Federal health officials say they only have tests for 400,000 people, and that's short of demand.
We don't have enough tests today to meet what we anticipate will be the demand going forward.
The Senate passed an $8 billion coronavirus funding package, which President Trump is expected to sign today. Now, tests for more than 1.5 million people are reportedly going to become available by the end of next week. We're live in Mineola, Long Island. Jenna DeAngelis, CBS 2 News.
Jenna, thank you.